Okay, that is us now being recorded. It is so lovely to see so many people joining us today and a really good turnout for this first series, this first event in these PGR postgraduate webinar series in the current relating to current issues in medical law and ethics. So a bit about this event before we get into information about the speaker and the presentation itself, as well as the responses. So this event, the Current Issues in Medical Law and Ethics Postgraduate Webinar Series, is a collaboration with three institutes across three universities. So it's with the Mason Institute here at the University of Edinburgh, and then we have the Center for Health, Law and Society at the University of Bristol, and the third institution is the Center for Social Ethics and Policy at the University of Manchester. We launched this program it's about 2 years old now, I think, so it was launched during the pandemic. And today's presentation is done by an individual from the University of Edinburgh, from the Mason Institute. And it's the first one. The next two will happen at the different institutes that we're collaborating with. Today's presenter is Ms. Ruby Reed-Berendt. She is a research associate and a PhD candidate here at the Edinburgh Law School. She's also a deputy director of the Mason Institute. Ruby's PhD research is relating to mental health and mental capacity legislation. Her research interests lie in mental health and capacity legislation, healthcare systems, and devolved lawmaking. Her presentation today is on opt-out legislation for organ donation in Northern Ireland. And this research was undertaken as part of a BA Liverhume small grant project titled Legal Transplants and Policy Transfers, Legislating for Organ Donation in a Devolved UK. So the way today's event will work is we will have a 20-minute presentation from Ruby and then two responses, one from each participating institution. So one response will be given by Bonnie Ventna from the University of Bristol, and the other one will be given by Laura O'Donovan from the University of Manchester. Bonnie is a PhD candidate and a teaching associate at the University of Bristol Law School. Her PhD is based on an empirically informed evaluation of the living kidney donor assessment process in England and Wales. She has previously published 15 peer-reviewed publications, which to a great extent focuses on the ethical legal aspects of organ donation and transplantation. More recently, Bonnie was invited to join an international working group based at New York University, which aims to create an ethics framework for xenotransplantation implementation. That was a mouthful. I hope I said that properly. And Laura is a part-time teaching associate at the University of Manchester and a Wellcome Research Associate at Lancaster University on a project titled The Future of Human Reproduction. She does research on the regulation of reproduction and the family, and following on from her PhD on legal and ethical challenges raised by uterine transplantation, she has developed an interest in the move to opt out in England and Scotland and the question of organ and tissue exclusions. So we would like, for today's presentation, before I hand over to Ruby to get us going, I just want to mention that the chat function is currently disabled. And this is just so we do not have any distractions for the presenter. We will enable the chat function when we have a Q&A session after the presentation and responses. This will last for about half an hour. And if there are any further discussions that would like to take place, we do have some time at the end to allow for this. All right, I'm going to hand over to Ruby now.
Thanks, Zara, and hi, everybody. Nice to see so many faces out there. I'm just going to share my screen, so hopefully that will work fine. So I'm hoping you can now all see the presentation. So as Zara said, today's presentation is looking at the move to opt-out organ donation, also called deemed consent, in Northern Ireland, and the legislation that was passed earlier this year. And as she said, this is based on a project that I've been undertaking with colleagues at Edinburgh and Cardiff universities. It's a qualitative socio-legal study, which is looking at how the opt-out legislation was passed for organ donation across the different UK nations. So this includes looking at England, Scotland, Wales, and Northern Ireland. And our focus was mainly on what points of similarity and difference had come up in the legislative regimes and how the laws came to be passed, who the key actors were, any connections between the nations that led to the legislation being passed. So this idea of what the problem was represented to be in each of the nations. And we undertook the research via a documentary review looking at the legislation, its supporting documents, any policy documentation, as well as the debates that took place in Parliament. And we interviewed a number of stakeholders across the different nations to consider it. So the project was led by Professor John Harrington at Cardiff University, with Dr. Matthew Watkins supporting there. And the co-investigator was Professor Anne-Marie Farrell here at University of Edinburgh with myself, and together we focused on the Scotland and Northern Ireland elements of the story. So that's the kind of background to what I'm going to be discussing today. The project itself essentially starts with the point of we don't know where we've come from in terms of organ donation. So prior to the soft opt-out being adopted, we had within the UK a system of opt-in, which essentially meant that in England and Wales and in Northern Ireland, under the Human Tissue Act 2004, individuals had to give informed consent, which was called appropriate consent, for the removal and storage of their organs for transplantation. And in Scotland, it mirrored this requirement, but with the terminology of authorization instead of the terminology of consent. So a requirement for the individual to have expressly authorized the removal of their tissues, which normally means having expressly signed up on the organ donor register. What we're talking about today is a move away from that legislation and towards soft opt-out legislation instead. So very briefly, soft opt-out is essentially enabling people to either opt in to donate their organs by expressing a decision to do so on the organ donor register, taking a decision to opt out also via the organ donor register. But if they do neither of those things, i.e. if they don't express a decision or a wish during their lifetime, they will be deemed to have consented to or to have authorized the use of organs after their death. So this is the idea of deemed consent, or as it's known in Scotland, deemed authorization. And under soft opt-out, the family is still involved in the decision. So this is the crucial distinction between soft and hard versions of opt-out, whereas in hard opt-out, the decision to use the organs for transplantation is made regardless of the wishes of the family. In soft opt-out, the family remains involved in the decision, and the family is still given the opportunity to express an objection to the use of the organs. And one of the things that soft opt-out really seeks to do, which we talked to lots of participants in this project, is to shift the conversation between the healthcare workers and the family members. So whereas in a opt-in system, they would approach the family and say, would you be willing to donate your loved one's organs? The discussion would now go something along the lines of, your loved one did not express a wish during their lifetime, therefore we would presume that they would wish to donate their organs. Tell us more about their wishes. So the idea is to shift the focus of the conversation through the opt-out system to facilitate and encourage more people to donate their loved one's organs if they die in circumstances where they can be used. And what we've seen in the UK over the past 20 or so years is this move towards soft opt-out as an appropriate solution. And each of the 4 nations has separately legislated for this. And the story begins right back in 2008, where the Organ Donation Task Force published a report on soft out, but didn't recommend that it was introduced into legislation, mainly citing opposition from religious groups and concerns about some of the ethical considerations of soft opt-out. After this, we then see a shift incrementally across the different UK nations, starting with Wales in 2013, who passed the Human Transplantation Wales Act. Subsequently, England and Scotland, very close together, also passed their versions of the legislation of similar ilk. And we finally reached 2022, where Northern Ireland passed its version of the legislation. And that's what I'm going to be focusing on today. Again, a little bit more context to give here in terms of Northern Ireland and the way that lawmaking works in Northern Ireland gives it's really important background to how this legislation came to be passed here. So the first thing to know is that the devolution settlement in Northern Ireland is based off the Belfast Agreement and the Northern Ireland Act of 1998, which comes off the backdrop of decades of violent conflict, the Troubles as they were known, between factions in Northern Ireland who believed that it should be reunified with the Republic of Ireland, the so-called unionists, and then the so-called, essentially you have on the one side the unionists who are DUP and the other parties such as the Ulster Unionist Party who are looking to keep with the UK, so to retain Northern Ireland as part of the United Kingdom, and then the nationalists on the other side, who were looking to reunify Northern Ireland with the rest of the Republic. So on the backdrop of that, we now have a power sharing arrangement as between the parties, which means that we've got the 90 members of the Legislative Assembly who are elected to sit in the legislative chamber, and they have to designate themselves as either unionist, nationalist, or other. Whoever has the largest designation in the Assembly, and whichever party comes from that, is then able to nominate the First Minister of Northern Ireland, and the Deputy First Minister is nominated by the other designation. So there's this power sharing mandate as between the executive, and the rest of the ministers are then selected through what's known as the D'Hondt formula, which essentially means that they come from various political factions and various political parties across Northern Ireland. So you end up with this executive body that's geared towards power sharing of these two factions, which are still incredibly fractured in the common environment. The other important thing to note about that is that the coalition is mandatory, so that if one side, so one party, the DUP in this example, refuses to go into coalition with the other, then the power sharing cannot happen, and there is no executive that is formed, and there is no assembly that's formed. And that's the situation that Northern Ireland are currently in since the elections in May this year, where no executive has been formed because the DUP has refused to go into government with Sinn Féin as a result of their opposition to the Brexit protocol. So there are ongoing political differences, and it's an inherently very unstable settlement, and that's something a lot of our participants talked about at length. So with that in mind, we're now going to look a little closer at the story of what happened in Northern Ireland, which actually goes a lot further back than the legislation itself. We start in the 2015-2016 area. So at this point, this was when opt-out really was beginning to gain momentum across the UK. Wales had already passed their version of the Act. And a member within the Legislative Assembly in Northern Ireland, Joanne Dobson, brought forward a bill of her own to introduce soft opt-out into Northern Ireland. At the time, that bill was not supported. There was opposition from the Health Committee, who essentially voted the whole bill down, except for one paragraph, which placed a duty on ministers to promote organ donation, and that was retained and passed into law, but the rest of it was abandoned. At the time, what our participants talk about is two key areas of opposition to the bill. The first came from the clinicians, the transplant community, who felt that the change in law could potentially be detrimental, could potentially put people off donating their organs and cause a downwards trend in the number of people who came forward and the number of organs that were available. But our participants also talked about political opposition. So the fact that Joanne Dobson was a member of the Ulster Unionist Party, and that meant that the Democratic Unionist Party, despite coming from the same designation, didn't want to support it because they didn't bring it forward. And similarly, the other factions, so the nationalists like Sinn Féin, didn't support it either because it had been brought forward by a Unionist Party member. So essentially, we see politics already playing quite a key role in whether or not this is going to get adopted. After that happened in January 2017, local tensions between the DUP and Sinn Féin led to the collapse of power sharing in the executive, and Northern Ireland was left without a government for 3 years until power sharing was restored in 2020. At this point, it was almost impossible to bring any legislation forwards because there was no functional executive. So it looked like opt-out was very much dead in the water at this point in time. Our participants also talked about the fact that even whilst the support for organ donation was there had been that legislation passed in 2016, which put a duty on ministers. Because opt-out had been rejected by the Assembly earlier, civil servants who were in place couldn't be seen to support the work of campaigners. So although campaigners might have good relationships with them, it wasn't possible for a civil servant to take a position that was seen to be supporting of opt-out. And the quote that I put on the screen from one of our participants captures that very well, this idea that we can't be seen to supporting any change in the law at this stage. In the period where there was no assembly and no executive, we also see the launch of the Donate for Daithí campaign. So this was based around a little boy called Daithí McGovern, who was 2 years old at the time of the launch of the campaign and is on the waiting list for a heart transplant. And his parents, who live in Belfast, decided to campaign for, first of all, promoting organ donation, and then secondly, soft opt-out. And here we also see the fact that the assembly wasn't live, affecting the strategy of the campaign groups. So the campaign started at local level with the McGovern family and the campaign really targeting local politicians and local councils to pass motions in support of soft opt-out, and they were very successful in getting support and starting to lobby politicians and talk to politicians behind closed doors, so that once the assembly did get back up and running again, and the hope was that that would be at some point in the not too distant future, they knew that they might already have a baseline level of support there, and they already had the connections and the collaborations there to facilitate change. In January 2020, we have the New Decade, New Approach deal that allows power sharing to be restored, with the DUP coming back in to nominate a First Minister and Sinn Féin with the Deputy First Minister. Robin Swan took up the role of Health Minister at that time from the Ulster Unionist Party, so neither of the two biggest parties. And it seemed like at that point, momentum was building behind soft opt-out. So the first meeting of the Health Committee, the members of the Donate for Dalhousie campaign were invited to speak to the conveners, one of whom was a Sinn Féin politician and the other was the DUP. So the chair of that committee was Sinn Féin, the deputy chair was DUP, and both of them were supportive at the time. There was a plan for the campaign to also meet with Robin Swan, but unfortunately that didn't take place because in March 2020, everything changed and those meetings were cancelled. But despite this, momentum seemed to be maintained, and in summer 2020, Robin Swan announced his intention to bring forward a ministerial bill introducing opt-out, as opposed to something like a private members bill, which had been mooted by a Sinn Féin politician just before it, and stated clearly his intention to bring forward a consultation in the autumn. So that consultation was then launched in autumn 2020, and the wording of the consultation was chosen very carefully. It didn't ask the question of whether or not opt-out should be introduced in Northern Ireland, but how it would be facilitated. So not the principal question per se, but more the implementation question. And this was a very deliberate choice, as far as our participants told us, to try and make sure the number of responses they had would be limited. So as one individual told us, it wasn't about would we or wouldn't we, it was more about the minister having made this decision, we're going to go down an opt-out system, how best can we do this, as opposed to whether or not we shouldn't. And then part of that was to try and limit the number of responses and the ambit of the responses that they were going to get. That may not have been entirely successful. It was one of the department's most responded to consultations ever. But I think it did demonstrate that there was really an appetite to do this from a political perspective, certainly within the Department of Health at the time. Another participant talked about this also being a strength of support in terms of the minister coming out very strongly and saying he felt strongly about opt-out, and also recognizing that a lot of scrutiny had already taken place. So because of this 2013 private members bill, there'd been parliamentary scrutiny in the past, there'd been media engagement in the past, and it wasn't a case that the concept was brand new and that we needed to start from scratch again in terms of the work that had already been done. Not everybody was so positive about the decision to do so. Another of our participants talked about it feeling like a fait accompli, and it really stifling the opportunity for people to raise concerns about what was being brought in, because they weren't being asked how they felt about it, but simply told that this is what the ministers decided is going to happen. So far, so good. Then things appeared to go a little bit quiet as far as we understand, and certainly by June 2021, there was some concern about whether or not this was actually going to happen, because no bill had been brought forward, nothing had made it to the Assembly, despite the response to the consultation supposedly being very encouraging. And campaigners started to worry about whether there was sufficient time to do so. So the first quote on the screen here talks about the fact that there was a lot going on politically at the time, the pandemic, the issues of politicians as across all the UK nations, breaking lockdown rules, political instability, the opposition to the protocol now appearing from the DUP, and the fact that the political environment in Northern Ireland is so inherently unstable, it was unclear whether or not the Assembly would stay in place for long enough for the legislation to come through. But also the fact that the next set of elections was due to take place in May of 2022, and therefore it was unclear whether there was actually enough time in terms of the legislative timetable to allow the bill to get through. And what appeared to be happening, from what our participants have told us, is that the legislation was being blocked from getting into the Assembly. So as another participant said, the biggest issue was the DUP essentially opposing the legislation. So this is another thing about the power sharing arrangement in Northern Ireland, is that both the First Minister and the Deputy First Minister, who co-chair the executive, have to agree to a bill proceeding to the Assembly floor before it can do so. And at the time, the DUP were going under a lot of change. So Arlene Foster was First Minister, Buster Job was replaced, that person was then replaced as well. And it seemed like the DUP, there was not consensus within the DUP that this legislation should go forward. So they were blocking the bill going forward. And it wasn't happening, and it wasn't happening. So we come into June 2021 knowing, from certainly campaigners' viewpoint, that if the legislation didn't get into the Assembly before the summer recess, there wouldn't be time for it to happen. And this led to probably one of the key inflection points of this story, which was the Donate for Daithí campaign learning that the executive wasn't going to be considering this at their meeting in June 2022 and posting this tweet online. So, confirmed, soft opt-out, not on today's agenda. Why are you blocking the democratic process, DUP? And this very clear photo, image, DUP, why are you blocking soft opt-out donation? Hashtag soft opt-out NI now. And this was posted at 10:30, as you'll see, AM on June the 24th. This tweet received 400,000 approximately impressions on Twitter and generated a huge amount of media interest. And later that night, at about 9 p.m, Paul Givan, the then First Minister, called Daithí McGovern's father to discuss the campaign with him. And he talked about this during the final debate. The impact that this particular conversation had on him. And then that evening at 9:58, he then tweeted to say that he had given approval for the legislation to proceed to the Assembly. Once we get into the Assembly, things then become relatively clear sailing. The legislation was pretty much supported across all of the parties, so no amendments being introduced whatsoever during its passage, and very few people, if any, voting against it. And this was something campaigners felt very aware of. And it managed to pass despite the resignation of Paul Givan in February 2022 and the collapse of the power sharing arrangement in Northern Ireland once again at that point, and became law, having received royal assent at the end of March 2022. So that's the story of the legislation. And what we were really looking at is what key things happened to allow these particular challenges, and quite unique challenges, to Northern Ireland to be overcome. So first of all, we have three key actors that I would identify. The first is the minister himself. So many of our participants talked about the minister having quite a strong personal commitment and personal belief in soft opt-out and pushing the bill through really hard. So that was seen in the wording of the consultation document and in his personal commitments to get it through and to give the civil servants who worked for him all the means that they needed to allow this to happen. So he was kind of the first big actor. One of the other things that was important is that as a member of the executive, as the Minister for Health, it meant that it wasn't a private member's bill, it was an executive bill. And this gave it a great deal more support in terms of the drafting process, but also made it less political. Even though Robin Swan came from the same party as Joanne Dobson, the bill wasn't politicised in the same way that hers was. We then come to the McGovern family and Daithí in particular, and what our participants talked about was his ability to really get across the political divide in Northern Ireland and to gain support across the political spectrum, which is considered pretty unusual as far as Northern Ireland goes. And I think that in particular, it's not really surprising that the legislation has been named after him as Daithí's law. The third group is the clinicians, and I talked a little bit earlier about how their opposition to the bill was very crucial in the beginning. Towards the end, the shift in the view of the clinicians was also something that was really important. So campaigners talked about a letter that they received from the lead surgeon for transplantation in Northern Ireland, who said he was against it originally, but he's for it now. He felt that the infrastructure was now in place and things were now in place to allow them to bring this forward. And the campaigners were able to use this letter to bring politicians on board and to show that there wasn't the same level of clinical opposition as last time, or certainly if there was clinical opposition, it wasn't nearly as vocal as it was last time either. So those three groups all together were able to essentially form a collective to really push for this to happen and allow this to come forward. And the other key element that seems to have facilitated this shift to soft opt-out is the discourse that is being adopted. So not just why this was a good policy in terms of saving lives, in terms of making more organs available for transplantation, but also specific other elements to Northern Ireland. So the first one being this idea of falling behind the UK and needing to catch up with what was happening and complete the UK jigsaw, as one of the BHF, British Heart Foundation campaigners, talks about in the news. The second, this idea of shifting perception. So trying to change the culture, make donation the norm rather than the exception, and using soft opt-out to do that, because we're recognizing that people do think this is generally a good thing. The idea that the law wouldn't change everything. So it's not a magic wand, it's more about doing everything we can in the right direction. So one of our participants talked about a funnel analogy, that we're trying to just increase the funnel of when organs can come in just a little bit, and even a little bit is a step in the right direction. And finally, this idea of the time being right. So we now have the infrastructure in place, we're ready, we need this to improve, and we're going to the party at the right time. So last to the party, but maybe not late to the party. And certainly Northern Ireland had this idea of having writing legislation, they were able to mirror England, and having implemented the legislation, they were also able to learn the lessons from others. So just to very briefly sum up, I think the title of this presentation, this idea of a collective movement, very much sums up the story in Northern Ireland in terms of a collective movement of different groups coming together who believed in this policy solution, and indeed a collective movement across the UK, this idea of a jigsaw that was coming together. Of course, it remains to be seen whether or not the change in legislation will deliver the desired effects. But I suppose that will be one that we'll have to watch bear out over the next few years. Thanks.
Thank you, Ruby, for that very informative presentation. I'd like to call on Laura first. Sorry, I'd like to call on Bonnie first for your response. You have 5 minutes, and then we will then move on to Laura in case if there are any questions. I'd allow Ruby to reply first before moving on to Laura.
Good afternoon, everyone. Firstly, Ruby, thank you so much for that. It was absolutely fascinating. Heard you present before on the project, and so nice now to almost get that final piece in of how it went in Northern Ireland. So I have two basically comments and one question. I think the main thing is, and I just love it how you said at the end, you know, the main thing that you said is that the law cannot change everything, because it's such an important thing. I think often countries make this swap to a deemed consent or an opt-out system, and they think the law, just changing the law is enough. And what I was thinking while you were talking is the role that social media actually played in this, especially if you think about the promotion and the social media, and then it almost links to this idea of, well, the law can't change everything, but all of a sudden we see the role social media can play in these kind of ideas, how that almost fills some of the gaps as well. So that was something that definitely stood out for me. Then something else I was wondering is, and this is kind of that where you said in 2014 to 2015, the idea they took in is this idea of the duty to still at least promote organ donation. And I do wonder, since they kind of implemented that at that time, whether it almost, even though Northern Ireland came in last, put them in a better position as well. Because they already had these public campaigns going around, so people were a bit more maybe aware of the idea of organ donation, so they came to perhaps a bit more informed, but this is just me kind of wondering. Then something I was interested in, as you know, I come from a living kidney donation kind of perspective. Feel a bit lost and out of touch with deceased at the moment. And that is that I've often come across literature that refers to the fact that when countries implement an opt-out system, living donation rates usually drop. And I was wondering, when you were doing your interviews, did this come up at all at some stage? Did people talk about ways that they'll make sure that living donation was still incorporated or still, you know, a focus, or didn't the participants really reflect on that?
That was a great question. Thanks, Bonnie. And I think I definitely agree. I think the role of social media is one of the really fascinating aspects of this story, and certainly the kind of the power of the personal story and the ability to galvanize support in that kind of way, and the law not being kind of the be all and end all. So I think one of the things that certainly lots of the participants talked about is this idea of a package of measures, and everyone talks about Spain as being the kind of poster boy in terms of organ donation, because they've got the infrastructure and they've got the deemed consent system, and everyone says, well, we just did it the other way around. We went for the infrastructure first, and that's what the kind of task force recommendations were about, and now we've got deemed consent. And it's really kind of seeing those things as all together. It's about promotion, it's about soft opt-out, it's about all of them as a kind of package of measures to try and encourage them. In terms of living donation, it was really interesting actually that lots of people seem to very much focus on this being a story of dead donation, even though there are definitely some continuities. So obviously the family and the context of the family is really, really important in a soft opt-out system, and the idea of maintaining that role of the family regardless of whether it's opt-in or opt-out. And I know that similar kind of challenges around the family definitely exist in the living context as well. But it's not really something that participants talked about at length. They were more, I think, worried about the drop-off that's maybe seen when soft opt-out is brought in, because lots of the experience of that is maybe for the first year, donation rates dip slightly, and then they start to go up again. And Wales, then the early evidence coming out of Wales, I think people are quite pleased that hasn't happened in Wales, and it seems like it is maybe making a difference, but it's still early days. I think upwards of 10 years is what they say it normally takes to actually analyse whether a system's working or not.
Oh, great, thanks for that. And then just the final kind of question is, I wanted to ask you, while you were doing the interviews, was there any kind of unexpected finding? Did you go in and you had this kind of idea, and was there anything that kind of took you by surprise, or was it more or less what you expected?
I think there were some probably slightly surprising findings, more in terms of, I suppose, how much the situation in Northern Ireland, how much the instability really influenced what happened. And I don't think I was expecting the extent to which that would have had an influence, and the role of social media. So this whole tweet moment, I think, wasn't something I think we thought we would find. And that was really fascinating to kind of see that as well.
Thank you, Bonnie, and thank you, Ruby. I'd like to invite Laura now for your response, which is also 5 minutes. But if there are any questions for Ruby, then Ruby will reply before we open up to Q&A with the audience.
Okay, great. Can you hear me, first of all? We've got fancy new microphones now. We're going up in the world. So thanks for that excellent presentation, Ruby. I didn't know much about the development of the opt-out law in Northern Ireland, or the difficulty that proponents had getting opt-out on the legislative agenda, so I found that really interesting. I was struck by a few of the comments by the participants and the design of the consultation itself. First, that the issue was one of how to implement opt-out, not if, and that some participants felt like it was a fait accompli. And secondly, the view that it was felt that Northern Ireland was falling behind the rest of the UK. And I found that interesting because it seems that across the UK, the shift to opt-out was something that governments were determined to make happen. And that's despite the fact that the evidence base around efficacy of opt-out is rather ambiguous. And I think this point about evidence is not one that can be escaped, right? Because clearly the pandemic had an unprecedented impact on transplantation activities, and opt-out was also introduced in England and Scotland at different stages of the pandemic when the NHS was just completely overwhelmed with COVID cases. So it's going to be some time yet before we're able to look at procurement figures in those parts of the UK to assess the efficacy of opt-out. But we do have some figures from Wales. So I was reading the other day, because I was teaching organ donation in a medical law module here. And I was looking at the research from Jane Noyes and colleagues, and they conducted an observational study looking at the consent rate in Wales at 3 years prior to the move to opt-out and 18 months after the move to opt-out. And they found that while consent rates had increased compared with the 3 years before, over the same period, consent rates had also significantly increased across the UK, and that's when we had the previous opt-in system. So I guess my first question is, I wondered whether any of the participants had expressed any comments about the lack of evidence, or rather the uncertainty of the evidence around opt-out and its effects on closing the transplant gap. Because clearly the minister is a big actor here, and so is the Donate for Dahi campaign, and they obviously strongly supported opt-out, but the evidence is still rather ambiguous. So I just wondered if there'd been any comments about that.
Yeah, I totally agree with all of what you said there. And it is, I think there were quite a lot of commentary. So as you can imagine, when it was going through, all eyes were very much on Wales and what Wales were doing and how much Wales had managed to do. And I think there was quite a lot of anxiety about what the statistics would be that were coming out of Wales and whether that would tell a good story or tell a bad story. And certainly from reading the transcripts of the debates in the Assembly, they seemed to put quite a positive spin on Wales, but some of the other participants were maybe not quite so positive. I think one of them made a comment saying, well, at least it hasn't made it any worse in Wales, is what we can definitely say, which was definitely quite interesting to see as well. And I think really the way they got around that was by trying to say, we're not just trying to drive up donation rates here. This is part of a bigger picture piece of work. So the falling behind one is also an interesting part of that, because sometimes Northern Ireland certainly is quite distinguishable from the rest of the UK and doesn't necessarily want, or certainly parts of the political spectrum there don't want to be seen to fall in line with the rest of the UK. But I think in this context, that was very much something they wanted to be seen as, and that might be partly because the procurement process for organs is a UK-wide process, and NHS Blood and Transplant run it regardless of which nation you're in. But this idea of changing culture would seem to be really, really key. So it's not just about donation rates, it's about normalizing organ donation, it's about normalizing the conversation. So I think it was almost that evidential issue was kind of sidestepped, because they were able to make the policy, represent the policy as being more about doing wider things for culture and societal change, rather than just being focused on a question of efficacy. But I agree with you, I think the question is very valid, and we need to continue to interrogate it as the implementation process kind of rolls on.
Yeah, thanks for that. I think that probably leads into the next comment and question that I've got, and to add to Bonnie's comments about sort of, and your own reflections about this being a package of measures and sort of a culture shift. Because I think what all of this brings to bear is the fact that the opt-out system arguably isn't a panacea for dealing with the organ shortage, and that other incentives and measures are going to be needed to close the transplant gap. And talking about the duty on the Department of Health to promote transplantation and the change in the law, it's obviously a positive step that there is a statutory duty included in the legislation on the Department of Health, and there is a similar duty on ministers in Scotland and Wales as well. And England is a bit of an outlier in that respect, because we don't have a similar duty in the legislation here, when arguably I think we probably should. Yeah, so my question is basically, are there any, in the discussions with the participants, were any other plans outlined for any other interventions or any other kind of strategies for improving donation rates? Because to go back to that paper by Noyes and colleagues, they essentially conclude that policymakers shouldn't assume that soft opt-out systems by themselves simply just need more time to have a meaningful effect, that ongoing interventions are going to be needed to further enhance implementation and the public's understanding. And so, yeah, so I just wondered whether there were any other plans for any other incentives, because I think in certain regions in Spain and in certain hospitals, I know that the question of donation is approached when patients and their families are in the ICU. And I don't think we follow that approach here. And I also know that in some regions, reimbursements are made for funeral expenses for donors in Spain. So I just wondered, had there been any other discussion about any other measures or other strategies to try and have this culture shift and make donation the norm?
Yeah, I think you just reminded me of something I was going to say to Bonnie, actually, which was what's also quite interesting about this duty to promote, and certainly what a couple of the participants also talked about, was we didn't actually give it enough time to see whether that duty to promote would make a difference before we went for soft opt-out, because remember, we had no government after we passed that, so there wasn't necessarily the ability to implement the measures and the package of funding, so millions of pounds funding that was put aside to allow these promotional duties to be discharged by the minister. So that was also something quite interesting to think about, whether this idea of being ready seem to rely on this previous statute, but it's perhaps questionable as to whether there was sufficient time to actually see change happen. I think promotion is definitely part of it. So one of the things that Northern Ireland obviously are doing in now is their implementation phase. They're not due to implement the bill until next spring, and very much kind of active campaigning around the change in law, but generally raising awareness, and has ongoing campaigning kind of throughout time to continue to raise awareness. And it is fascinating to see how the materials they're using are almost identical to the materials that were used in England and Scotland to do the campaigning. So I think we even found a like for like video that was produced with a person holding a cup of tea and talking about a discussion about organ donation to have with your families. So this idea of this kind of mantra of talk to your families, tell them what you want to happen, seems to be the main thing that's going on. And I think the other piece of terminology that's being used, and this isn't necessarily a policy decision, but it is something that's interesting, is they talk about organ donation as a decision. So this idea of when specialist nurses for organ donation approach the family in ICU, which I think does happen sometimes, they talk about the individual having made a decision to donate their organs, not expressed a wish, not thought about it. They've made a decision, and this was this person's decision. So there is almost that slight change in tone that's been enabled by the opt-out system, which I think they talk about as what's the key, some of the key elements that they hope will help here. But I think that the main plan, as far as I can see from what participants said, is to continue with this package of ongoing promotion, ongoing discussion of organ donation to kind of keep it in the public eye, to lead to a situation where I think what they want to happen is it even a question to donate your organs? Is it not just what we do generally? And then that seems to be the general thrust of where things want to go. I haven't seen evidence of kind of other measures like the ones you mentioned in Spain around reimbursement, but it will be interesting to see what they turn to next. Oh, my light's gone off in my room, but hopefully you can still see me.
Yeah, no, that's great. Thank you. That's really interesting. And I just have one final comment. And actually, that's fascinating that you talked there about how Northern Ireland had sort of adopted some of the same things that we'd done here when it comes to their media and educational campaigns. And yet something quite different compared to England, Scotland and Wales is their approach to the drafting of regulations. So my final point, I wanted to make a point about organ and tissue exclusions, because that's something I've been quite interested in. So Northern Ireland has decided to approach the design of accompanying regulations quite differently to the other UK nations, in that instead of prescribing lists of organs and tissues that are excluded or accepted from deemed consent or deemed authorization legislation, Northern Irish regulations will explicitly state the organs to which deemed consent will apply. And in a research and information paper about the bill, published by the Northern Ireland Assembly in 2021, learning from the experience of other jurisdictions is given as the reason for approaching the regulations differently. So I had wondered if that came up at all in your discussions, because I'm intrigued by what was learnt and what the reason for the different approach was. And with colleagues at Lancaster, Nicola Williams and Steve Wilkinson, we responded to a series of consultations in England, Scotland and Wales on organ and tissue exclusions. And one of the issues that we raised was the ad hoc approach that governments had adopted to deciding which organs and tissues to exclude from new opt-out laws. And it became a running joke with colleagues that I was essentially campaigning to have the anus added to the regulations. It still hasn't been added. No, but in all seriousness, these lists include random tissues, right, like the perineum, which seems random, but then they don't include other tissues like the anus, nipples, or skin from the breasts. And so there didn't seem to be a principled or sort of consistent basis upon which the decision was made about which organs and tissues to include. And so I wondered if part of the reason for the different approaches Northern Ireland is to sidestep that issue, right? You don't have to come up with these exhaustive lists. And also you don't necessarily need to consult the public again, because you're just listing common transplants, and we all know which organs are commonly transplanted. So yeah, so I just wondered if they'd said anything about that.
They hadn't, but I suspect you're right, to be honest, because certainly when we look at the kinds of connections that were going on, the fact that they were talking to the civil servants in the other countries to kind of, decide what to do, I think you're definitely right that they probably will have gone, maybe that's too complicated. I know in Scotland there was an intensive amount of extra consultation and lots of discussion about what was in and what was out and who got to decide, which definitely seems to me to be quite complicated. I don't think we may have interviewed a few people before. I think they'd made any decisions about this, which might have been why we didn't talk about, but it is definitely really interesting to this idea of what is a normal transplant and what isn't. And I think you're probably right that the different strategy that's been adopted here might well be them saying, well, that clearly didn't work there, so let's do something more simple. I don't know if the cynic in me wonders whether part of that's also because there is no functional executive at the moment, so simplicity might have been the aim of the game as well in terms of the civil servants during this new period of kind of uncertainty that they're in Northern Ireland at the moment as well.
Thanks.
Thank you, Lauren. Thank you, Ruby.